ARcare is about serving. We look for those who need to be served. All that matters is that if someone has a need, we find a way to meet that need.
We are saying we're here to serve the least, the last, the lost. And I love the fact that we're doing it. It's not uncommon that I meet people that tell me, and they can name their provider, they can name the doctor and say, he, she saved my life.
I have experienced so much growth working here. There's just so much that can happen here. Like it really is a breeding ground for growth.
I've been in the healthcare industry now for 22 years and I've worked for some great organizations, but I truly feel that I've found not only a home but a family. You know, I can wake up every morning and feel privileged to come to work with such talented individuals that touch so many lives. There's a true compassion with this organization that you don't see in other healthcare organizations.
To be a part of a company that is doing things that other healthcare facilities are not doing for the people who are often overlooked is a great feeling.
As people say, being at ARcare, it seems like you're part of something bigger than yourself. So it is always nice to have that feeling either as a patient or as an employee.
I don't think there's another organization that I've ever been a part of or around that truly cares about the community. We're deep inside. We look for what communities need, and there aren't a lot of businesses that do that.
You know, I have people tell me every day that they appreciate what we do for them, and that they received the kind of care that they wanted. It's when I hear things like that, that's what keeps me going.
The cause, the mission of ARcare touched my heart so deeply that I chose to come here. I feel like we are serving a great purpose.
I was working a lot of overtime where I was at before, so it put a strain on my family. And my office manager at the time, Mary Holden, and a co-worker, Mary Quarles, knew that we were struggling. So they went out and they bought Christmas presents for my boys. My first day, I knew that this was home. They looked past what I didn't know to my potential.
I love that ARcare is part of the community. Nurses, providers, office staff, we are all a big family. And I'm really happy to know as many people as I've learned to come to love in the position that I'm in.
I've been at ARcare for over 23 years. And if you say, Joey, what's the passion in your job? I love sitting in that waiting room, talking to people, and helping them get through a complicated system so that they can walk home with their needs met.
ARcare, it's more than just a job. You don't dread getting up going to work. It's like a family here. Everybody works together to take care of our patients, and that's why I love it. I bring my family here and I wouldn't choose anywhere else. We have people that treat you more than just a number. Everyone is cared about here, and we'll do whatever it takes to make sure you are happy.
Since I've been at ARcare, we have lots of patients who could not afford their medication. And we work with patients to get them the right medication at the right cost that they can afford.
I know that indirectly I have the ability to impact their care, because if I do my job well, then we got the most resources that we can get to treat them the best that we can.
They do the best they can to get us to take care of everybody's medical needs, regardless of their insurance. It's great to me not to have to think about it. If they need help, we can get it for them.
I like ARcare's mission, their vision, and their values. To be that provider of first choice for someone that doesn't have a provider. I love the stewardship. I love the pride. I love all of those things that ARcare embodies.
I think Dr. Collier says it best, that we are for the least, the last, and the lost. And I think anybody who can tap into that vision, then you'll find your place.